Kyle Rose is with the International Diabetes Federation. Kyle is an international advocate focused on raising the voice of people with diabetes. He is currently Vice President, Board of Directors at the IDF, having been elected in December of 2019. His previous NGO experience includes roles at Innovative Medicines Initiative, Europe's largest public-private partnership in health, and Team Type 1, also known today as Team Novo Nordisk. Additionally, previous work experience includes executive roles at Roche, Bigfoot Biomedical, Smiths Medical, and Abbott and Sanofi. So everybody, this is Kyle. Thank you, Kyle.
Thanks so much, Brian. Hello, everyone. Good morning, good afternoon, good evening, depending on where you're joining us from. I'm going to jump right into my presentation here. And I'd like to start by thanking you, Brian, and the Lions Club for hosting today's event for World Diabetes Day. Honored to be here to represent the International Diabetes Federation. My name is Kyle Jacques Rose, and I'm IDF Vice President, non-healthcare personnel. In addition to my role at IDF, I wear a number of other hats in the healthcare and diabetes world. But first and foremost, I'm a person living with diabetes. I have since I was a teenager, and I'm absolutely passionate about advocating for our diabetes community. I don't know if I'll get a chance to speak about some of these other initiatives and projects that I'm involved with, but here are my contacts online, and I would hope that you would connect with me and so we could discuss them if they're of interest to you. I have some personal disclosures with some past and existing engagements to make you aware of. And I'll jump right into who is the International Diabetes Federation. So we are a member association federation, meaning that we have 240 national member associations, some of whom are represented today, like the American Diabetes Association, or also Fédération Française des Diabétiques, where I've spent some time working, and so forth in respective countries, 170 countries for that matter, and territories around the world. And we do work through our 7 regional offices. You've probably seen our Diabetes Atlas referenced. This is something we take a great amount of pride in, trying our best to have the most recent statistics as it relates to number of people with diabetes around the world. The numbers are grim, as previous speakers have mentioned. I won't highlight each specific region, but you can see, for example, in the African region, based on our Diabetes Atlas 9th edition, we see a 143% increase in the process. And unfortunately, these startling statistics are around the world. And each time we make a projection, we unfortunately are wrong, and the projection is exceeded by a huge amount. And an example here to better kind of illustrate what this graph is showing, the 2025 projection was made to be approximately 380 million people living with diabetes. And here we are in 2019 already with 463 million. And so this difference in this case of 83 million people, that trend continues as the graph indicates. And unfortunately, we are also aware, as several other speakers have highlighted, of the fatalities that diabetes complications can lead to. 4.2 million in the case of 2019, and an enormous expenditure of our economies and health systems. A few statistics I'd like to highlight are that 1 in 2 adults with diabetes are undiagnosed. That represents approximately 232 million people, as Brian and others have mentioned already. Over 3 in 4 people with diabetes live in low and middle income countries, and this correlation with socioeconomic levels is highly disturbing, and something we are seeing increasing trends and data to validate, both in the emerging countries around the world, developing countries, as well as right here in the United States, where we see a vast discrepancy, both in terms of prevalence and access and equity to care. But oftentimes at the International Diabetes Federation, we're talking about numbers, and these numbers are grim. The diabetes is more than just the numbers. It's about the people behind the numbers. And what better way, I thought, to show you a little bit about our projects, our programs, than to let you hear from one of our youth programs. So I'll show a video now, approximately 2 minutes long.
My hope for diabetes would be that people can live with diabetes.
It's a purpose that we should all work hard for it. Every person deserves the rights to have access to medication.
So the complications and comorbidities with diabetes are inherent, and there are a lot of problems out there on a population level.
The doctor told me when I diagnosed, like 5 years you will lost your eyes, 10 years you will lost your kidney. If you don't control your blood sugar, that will happen to everybody.
What we need to do is obviously be proactive with diabetes and not reactive to diabetes.
We're not only just the amputation capital of the world. Because of diabetes, we have the highest rate of death after amputation.
And now the number of the diabetes in China, the number is growing up.
60% of our population is living under $2 a day. The lowest rate of a while is around $7. Including that cost of the syringes, the cost of the testing and everything. Most people won't even have food to eat after taking their insulin.
For us, we need everything. It means that Africa, we just want to start from the grassroots level, going up. So it's just a matter of putting things on the table, and we get what needs to be done.
Right now, Blueprint Barbados is focusing on a lot of type 2 related projects and just diabetes related projects in general. I speak wherever I can, schools, hospitals, conferences.
We'll be setting up the first ever camp for children with diabetes in Pakistan, along with their families in March.
People talk about the change that you want to see in the world, and I believe as us as the young leaders, we are that change that needs to happen in the world of diabetes.
What a powerful statement from our future leaders of the diabetes community. This program is the Young Leaders with Diabetes program. One of my focuses in my work on the board. I work both with youth projects as well as technology. But it's particularly an emotional one this time watching this video. Lamin Diba, who you saw speak to you, from Gambia, unfortunately passed away in April of this year. A stark reminder of how difficult it is to be living with type 1 diabetes in a country like Gambia and all the challenges that are faced. He was a very active diabetes advocate who touched the lives of many people in his country and beyond, and will be forever remembered by the IDF community. And so we continue the struggle. I think it very much echoes the mission. We would like to live in a world without diabetes. However, we know that's not possible immediately. And in the meantime, we're promoting care, prevention, and cure worldwide. By improving health outcomes for people living with diabetes, prevention, and reducing stigma and discrimination against people with diabetes. And I know we have some really interesting examples that we're going to hear from an airline pilot later on in today's session. World Diabetes Day, of course, is one of the many ways we focus on raising awareness and promoting prevention, but a big focus for us is very much diabetes education. And that's why in World Diabetes Day 2020, we've followed the lead of other organizations to highlight the work of nurses and midwives and really spotlight them as a key stakeholder in our healthcare systems to educate people about diabetes, both from a prevention standpoint and a diabetes management standpoint. We're also well aware that there are huge gaps in access to care and supplies around the world. And we continue to try to elevate those issues and raise awareness with policymakers to make sure they're aware that their decisions are influencing our day-to-day as people living with diabetes. The last point I will touch upon a bit later in my presentation, but as someone who has worked for organizations heading partnerships, I'm a big believer that we need to work together as a community, whether it's with our national member associations or fantastic organizations like Lions Club. We're all in this together, and many of you are doing fantastic work, so we thank you for that. The nurse, as I mentioned, a pillar and influential stakeholder in healthcare systems all across the world. I happen to be married to one and have seen the incredible amount of work that nurses pour day in and day out to help people across the world. And we think that this can really be instrumental in filling in some of the gaps. That's why we have highlighted them as we admire and appreciate nurses for World Diabetes Day 2020. And if you're interested, we have a number of assets on our campaign on our website where you can make your picture in a blue circle and highlight that on your various social media, whether it's your organization or you personally. Continuing on with IDF activities, the IDF School of Diabetes focuses on education and continues that core focus of trying to educate people so we can take care of ourselves better and know how to take care of ourselves better as people living with diabetes. And I encourage you to take a look. The goal is to have 1 million people trained in the healthcare professional role by 2023. There's a number of ongoing programs, some of which have a cost, but have been made accessible. And there's a particular focus around the nurse. I would encourage you to take a look if you're interested via the IDF website. Again, focusing on education, the young people's environment, whether it be in elementary or primary school, is one that IDF takes very seriously in providing a safe environment for young people living with diabetes is exactly what the KIDS program focuses on. A third landmark event for IDF is our World Diabetes Congress. It happens every 2 years, most recently in Busan, Korea, December of 2019, where I was voted into my position on the board, and we have our General Assembly, but also a big scientific conference where researchers and stakeholders from across the diabetes world get together. We'll be having our next conference in Bangkok, Korea in December 2021, and perhaps depending on the environment, there may be an online or virtual component as we've had to face for many other events this year. The IDF Center of Education continues to focus on this education concept, an international collaborative voluntary network, improving high quality education. And perhaps more important than ever, this year, our disaster and emergency task forces that are working together with a number of organizations around the world, some of whom are represented here today, to help address the challenges for people with diabetes during something like a pandemic. Very closely tied to that is a program that used to be an IDF program, Life for a Child, today headed by Graham Ogle in Australia, independently doing amazing work to help secure life-saving insulin for children with diabetes who otherwise wouldn't have access to it. And I think that I'm always being reminded, I want to mention, by my fellow board members at IDF that even though the countries where I'm living, the COVID pandemic is clearly the #1 priority in many other countries around the world, where my fellow board members may be part of the ministries of health and so forth, they remind me that there are many public health issues going on in parallel. And actually COVID is one of many for them. And in challenges in the emerging and developing countries with lower socioeconomic levels, there are other diseases that continue to be a constant challenge in parallel. I have already mentioned the Diabetes Atlas. Please, if you have an interest, go onto our website and take a look. The statistics are updated constantly from our member associations on the ground to give us the most realistic view possible of prevalence. And we work with many other organizations to make that happen. And we try to make the policy influencers around the world working with our member organizations aware of those numbers and in hope of policy decisions that will help the diabetes cause. As I mentioned, partnerships are specifically an area that are important to me. I think that together as a community working across diabetes, across borders, we are much, much stronger. And we follow the lead of other organizations who are doing good work. And we applaud you all for the work you're doing in diabetes, whether it be the WHO or member associations like the American Diabetes Association, who we'll hear from later today. I think that together we can help develop the next generation of leaders, and it is why I thought it was so important to feature this video talking about our future leaders in the diabetes world. So please join us for World Diabetes Day. Join the conversation online. Download your blue circles and attach your pictures for your various organizations to show that together we can make a strong statement. And even though it's been a really tough year, I wanted to share with you some personal joy my family's had in the birth of our son, Aaron, who's given us a lot of smiles. Little Aaron Henri is on the left, taking a bite out of my glucometer. And my wife, who is a nurse in diabetes by training, Manon, is just on the other side of the snowman from me. I hope we'll have the chance to work together, and I really appreciate the opportunity to speak to you on behalf of IDF today. Thank you very much.
Thank you, Kyle. Thank you so much. We had a couple comments in our comment box that the video you played was very impactful. So thank you so much. And I wish you could deliver some of that snow here to Southern California, because I miss home. I'm from St. Louis area and I miss the snow just a little bit. So thank you so much. And Kyle, if you want to get information to Kyle's website, go to alliancediabetes.org, click speakers for today's speakers, and I have Kyle's website. And also this event today, I'm recording. In a couple of days, I will have the video uploaded to alliancediabetes.org. Thank you so much, Kyle.